Ladies and gentlemen, friends and families, good evening. This is Dr. Muhammad Adil. I'm fellow of the Royal College of Surgeons of United Kingdom. I am a general surgeon, specialist in breast, colorectal, laparoscopic, and endoscopic surgery. As a health professional with 35 years of standing, I felt obliged to comment on a disease which confused the entire world in early 2020, which was SARS-CoV-2, which was later named by WHO as COVID-19. Soon after that, UK went on lockdown. All the hospitals, those were shut for the patients. And it is highly regrettable that millions of patients lost their opportunity to have their investigations and treatment. All the elective clinics, operations, endoscopies were abandoned. I felt sorry for cancer patients, especially the breast and colorectal cancers. They lost their opportunity to have their investigations and treatment. Most of the patients from the hospitals were transferred to the nursing home and the care home in rush to accommodate the possible admissions of the COVID-19 patients. Within 4 months, from March 2020 to June 2020, 78,000 elderly patients died in nursing home due to isolation, dehydration, and lack of medical facilities. And it is highly regrettable. These patients could have been saved by skilled and competent hands in the hospitals. I felt difficult to swallow everything which I witnessed happening in the hospitals when most of the hospital beds were empty. And I had no choice, but went on to the social media and expressed my personal viewpoint regarding the proper management of the patients, especially the cancer patients who were waiting for their investigations and treatment, along with the possible COVID-19 patients. I was picked up by the trusts and the General Medical Council and got suspension on 1st of June 2020 for 12 months by the General Medical Council without being provided the GMC bundle and the proper time to prepare for my response. I went through 6 interim order tribunal panel hearings, but I was not able to get my license back. On 11th of January 2022, I had 6th interim order tribunal hearing where my suspension was converted to 14 unworkable conditions, which are causing a huge problem for me to get back into the job, because most of the trusts, they declined to offer me any employment. Same is the case with the locum agencies because of the conditions. GMC says they are workable, but actually these conditions are not workable. They are enforceable and they are draconian. So since my suspension has been lifted 2.5 months ago, I could not find any job until today, which is dispiriting. There are many realistic factors which we need to determine that why I have been ridiculed, isolated, victimized, and discriminated with a huge injustice since last 2 years, in spite of serving this country and this community for 30 plus years. Recently, Dr. Teresa and Laurie, who is the consultant evidence-based medical scientist in Bath, United Kingdom. She was impressed by Dr. Corey, Piers Corey, who is the intensivist. And he gave his testimony in front of the Senate of United States of America regarding ivermectin. And this is the frontline doctor who found dexamethasone. Both medicine they claimed were effective for controlling COVID-19. Dr. Tess Lowry, she was impressed by Dr. Corey, and she made further study on these two medications, and she presented her data to the Prime Minister, to Matt Hancock, previous Health Secretary of UK, and to the ministers, and she sent a letter to the WHO regarding the efficacy of ivermectin, which she claimed to protect 65 to 92% of the patients dying from COVID-19 and 82 to 92% of the health professionals. But her claim was rejected and she did not get any response. She was rather claimed as spreading misinformation. But I would like to say nothing has been done against her by the General Medical Council. If this was a case of spreading misinformation, which could be damaging to the patients. Ivermectin is not licensed in UK as a treatment for COVID-19 as yet. Secondly, recently you must have seen Dr. Steve James, consultant anaesthetist, King's College of London. He challenged Health Secretary Mr. Javed regarding vaccination. And he clearly told him that he will not be forced to get any vaccination to himself and to the health professionals. But no action has been taken against him by the GMC. And thanks to Dr. Steve James, since he refused to be vaccinated as a compulsory requisite for working for the NHS, the government has rolled back the NHS, the vaccination agenda to all the health professionals. Thirdly, Dr. Sam White, who is a young GP, who spoke against COVID-19 in June 2021. He spoke against social distancing and face masking and vaccination. And he clearly said that masks do no benefit. He was suspended by the NHS and the General Medical Council, but he was reinstated by the Honorable High Court. GMC did not put any conditions against his registration. His record is crystal clear, and he's working. Dr. Hilary Jones, he's a retired GP. He comes on various media, and his famous program is Good Morning Britain. He comes with Lauren. On 6th of December, 2021, he appeared in a program with Lorraine where he gave inaccurate information regarding the unvaccinated patients in the hospital in UK. And he had 3,500 complaints by the public reported by the Oxfam, but no action was taken either by the government or NHS or General Medical Council against him. And he is still on the media, and he is giving inaccurate and wrong information. He is not qualified to comment on COVID-19 and vaccination or anything because he's not specialist. Having said that, I have been through hell of a time since last 2 years. I was dismissed, ridiculed, suspended, went through various IoT hearings. Suspension was lifted in early January 22 with 14 unworkable conditions. Can you imagine the difference? How I have been treated by the General Medical Council compared to other people I have mentioned earlier on. It clearly shows an element of discrimination, victimization, and crucifixion in my case, which is absolutely unjustified, unwarranted, and inhuman. Myself and my family went through extremely difficult time. We had a financial hardship. My family went through a lot of stress, anxiety, and depression. That affected my children's education and their well-being, which is highly regrettable after serving to this community for 30 years. And I never, ever discriminate anybody on the basis of the color, race, religion, individuality, poor or rich. I treated everybody equally. I believe on equality and justice, and that's my belief. And I respect the humanity. But the way I have been treated, it's a huge injustice. There is a lot of problems are going on within NHS and General Medical Council, which I would like to emphasize at this stage after suffering for 2 years. Most of the ethnic minority qualified, skilled, and experienced doctors working within NHS, they work very hard. They have to prove better than the local boys and girls. But there is an element of discrimination and victimization to the junior colleagues. Most of the qualified and experienced and skilled surgeons end up their careers as a serving registrar, trust registrars, or staff grade. Very small number, they climb up to the ladder of the consultants. I yet to see doctor or health professional from the ethnic minority becoming medical director, chief executive, or higher up in the health authorities or NHS, which is not acceptable. This culture has to be removed from this beautiful country where we talk about equality and justice and humanity. And there is an element of unfair referral from the hospitals to the General Medical Council for minor mistakes with the clash of personality or misunderstanding by the senior colleagues. And the ethnic minority especially, they suffer a lot when they go into the General Medical Council. They go through GMC first, followed by the Interim Order Tribunal, followed by the Medical Professional Tribunal, MPTS, and it takes years and years. Most of these health professionals during their IoT and MPTS hearing, they are unable to tolerate the stress and anxiety and the pressure they go through during the investigation and the prolonged investigation, years and years. Hundreds of health professionals have suicided in this country, and their family has been ruined. Most of them leave the country and go back. Vast majority, they leave their profession as a medical professional and they go doing some odd jobs. Some of them, after the investigation with 3-4 years, are proved to be innocent. So I would like to ask, the sufferings and the difficulties they had seen along with their family is not recoverable. So that should be kept in mind and that should be rectified. And everybody should be treated equally and with respect to run our beautiful NHS system, which is best in the world, but is going down because of this discrimination, to be very honest with you. The General Medical Council has extreme powers of suspension, warnings, conditions, or erasures from the register through different departments after years and years of unnecessary and painful investigations. This culture is purely discriminatory, and most of the ethnic minority, they have been ridiculed by the General Medical Council, referred from the hospital by the NHS colleagues. We have to look very carefully into these matters, and General Medical Council should deal the matters fairly and respectfully, treating everybody equally without any radicalization and discrimination and victimization. At this stage, I am very disappointed by the General Medical Council, the way they have treated me and my family. And I would request to the Prime Minister, Boris Johnson, all the ministers of the cabinet, House of Commons, Health Secretary, Mr. Javed, to take away all the unnecessary powers by the General Medical Council to ridicule, suspend, or erase highly skilled, experienced, and qualified doctors. And these powers should be shuffled to the Honorable High Court. If there is any dispute, both parties should go to the High Court for the justice. This is my humble request. And at the end, I am really most grateful for all of you who have been very supportive and have been very encouraging. And thank you for your donation. I am contesting my case after going through so much difficulties for 2 years in the High Court. I need your generous financial support, encouragement, and prayers as well. Many thanks for listening to me. All the best. Bye for now. Thank you.